Good morning. This is the House Appropriations Committee. It is Friday, January 30th, 2026. It's 11 a.m. and we are back to focusing on the FY27 budget. And we have with us the Commissioner of the Department of Health and the Financial Director for the Department of Health. So welcome to both of you. And I'm trying to remember, were you here in December? Yeah, so you actually have met everybody.
Yes.
So
Yes.
Yes. So you can introduce yourselves for the record, and then we have your information here. And if you want to share screen, you can do that or not. It's up to you.
For the record, Rick Hildebrand, Commissioner for the Department of Health.
And for the record, Megan Polk, Financial Director of Vermont.
Thank you for having us. I'm going to give a high-level overview of a handful of things, and I will defer to Megan for a lot of the questions you likely will have about specific numbers. And we have a blank
Maybe I won't share my
presentation.
screen. It was loaded just a second ago. Hold on. You can get started. I'll
Okay.
catch up. See if
The first slide is our mission and our vision and our values. And again, I put this up often just to remind us all and to reconfirm our commitment to Vermonters that we stand by them in these challenging times, in this challenging landscape, and something that we feel very strongly about. The second slide is our organizational structure, which again, you've seen before. The health department consists of 616 positions in our central office, our 12 district offices, the Office of the Chief Medical Examiner, our warehouse, and our lab. It's a reminder to me and something I often refer to, the breadth of what the department does. We cover a lot of ground, and public health touches so many parts of our lives. And the health department does many things, including very clinically relevant things like in the Office of the Chief Medical Examiner. We do home visits for new families. We do laboratory testing, but we also do community-based work and very public health-based work, including ensuring the health and safety of our water and our air, food safety, things of that nature. And the other piece that I find helpful is just to remind myself and to remind us all that I've got people in all of these areas. We have people in all these areas that are experts in the fields. I am not the expert in all these fields, but we have incredibly intelligent people who have been studying these topics for decades that we can always rely on and can come into committee if needed. The other piece, just to say, is we love data and we provide a lot of data and reports other than the programmatic stuff to the legislature and to the state, including the State Health Improvement Plan, the State Health Assessment, Healthy Vermonters 2030 Dashboard, and many, many others. And these are resources if you care to review. You can see these reports and many others. Was that this week? Earlier this week, AHS came in and I can't believe that was this week, gave a high-level overview of the budget process that we had this year. It was very, very different. It was my first time, but from what I understand, it was very different than in years past. It was not looking at just the health department budget. It was looking at the entire agency as a whole, which was A, very helpful to see what we're looking at, but B, also made it challenging because we had to stack initiatives and things that we do in the health department against things that are being done in DEVA, things that are being done at Dale that touch patients' lives in a very, very dramatic way. And when looking at where we're going to invest our money and where we're going to make cuts, that was very much taken into consideration. And I want you to realize that when I walk through a couple of these things, which we want to keep everything. The health department feels strongly about all our programs, but when you put it in the context of the other programs we're looking at, that's where some of these decisions came from. Okay. All right. This is our pie chart that describes where our budgetary funds come from. And in the 2027 budget, we have a budget of just over $221 million. That's a 1.2% overall decrease from fiscal year 26. Federal funding remains the single largest source of funding for our department program. General funds account for 11% of the total budget. The general fund share of the budget plus the state share of global commitment is 22%. of the department's budget. Compared,
A decrease.
correct. Compared to 26, our global commitment budget request is $5 million lower, and the federal receipts are $1.1 million lower.
So I have this, we all got this spreadsheet for all the areas, so I can look through it, but is that a decrease in general fund also? Okay.
And the health department starts on page 10 of the AHS,
Yes,
I
okay.
believe. Yep.
Thank you. Wait,
What was the cause of these, things that weren't able to be billed? That's,
You're saying the federal receipts being lower?
I think it was just, it's a loss of some COVID era grants that ended in 2026, ended in 2026 that were not,
COVID
expected.
related.
Yes, most of them are COVID.
All right. So some of the most painful things that we often talk about are programmatic eliminations, and we are proposing 3. 2 of them are in workforce development, and 1 of them is the effort to implement an unused drug repository program. I do have slides on each of these. The Health Professionals Educational Assistance Program at a high level is a tuition reimbursement program, and the AHEC program is to promote health professions in high school and college students. And both of those eliminations, so the first one is 4.1 and change $1 million, and the AHEC is $550,000. And then we have not been able to implement the efforts to use the unused drugs. We have tried for a number of years, had not been able to start that up. So given that we were never able to start the program, we propose eliminating that. We don't think the funding is sufficient really to get that started. And when looking at cuts, not starting something you never started is one place we often.
that's a reasonable decision.
All right. So again, the first one, which is the largest line item, is the healthcare professional educational assistance programs operated by the University of Vermont's statewide area health education center, or VSAC, which is the Vermont State Assistance Corporation. Together, they provide forgivable loans for students and loan forgiveness for participating professionals in exchange for commitment to practice Vermont. The current funding level for the UVM program is $667,000 and $3.5 million for the program operated by SAC.
600,000 UVS.
Yep, 667,000 yep, for VSAC.
And
Of those 4.2 million, 3.4 is in nursing, about 420,000 is primary care physicians and APPs, 190,000 in dentists, and 100,000 in dental hygienists. That's how the breakdown of that 4.2 million is spent in tuition reimbursement and scholarship programs.
And tell us more about the thinking behind eliminating these particular programs when we have a workforce issue.
Sure. And again, I do want to impress that this has been a challenging year. We looked at a lot of different things, and when stacking it against programmatic cuts, services to individuals, this sort of felt lower on the list. It wasn't that we don't care about it. I will say there's also been, part of this last 6-month period of time has been an application for the Rural Health Transformation Program. And we do know that we had planned on and helped on making some investments in workforce development in that space. But really the primary driver was we've got a hard budget year when we're stacking against programs that are providing services to people versus these programs. We felt that these were of less importance. Not that they aren't important, and we wish we could continue them.
You had to prioritize.
Correct.
You weren't at the top of this. And I believe the Rural Health Transformation Grant limits what you can do for workforce.
It does. It has, as many grants do, it has particular clauses in it that limits what we can do. And very clearly would not be able to replace any program that we're currently doing with that. It does, however, provide funds that we could use in a different way. One thing that we look at with all our programs is how the programs are performing. And that's something we want to look very critically at. In the past we have. It's not that these programs have performed poorly. We believe there's an opportunity to do better. And the outcomes we've primarily looked at is how long people have been here for a period of time after they've graduated. Again, I think we have an opportunity to look at this, but again, the primary driver, just to be clear, it's been a tough year and it feels less of a burden.
Dave?
Just so that I can understand, if someone could give us a spreadsheet that says, here's we're reducing.
Yep.
That's what's being cut. It served this many people on average.
Yep.
And this is the part, here's what we're coming in with, the 195 million a share for scholarships.
Yep.
That we believe will serve X number of people. So we can see, are we gaining in total for workforce
Yep.
development, or are we losing?
Yes, I do want
Does
to.
somebody have that?
We can get that. I do want to be very clear. We are not replacing this program. Okay, this isn't a replacement of one for the other. It is a different way in which we fund workforce. Okay, the total amount of dollars we can absolutely get for you. How much
Will
we're
you
taking away.
explain to us the different way?
The pieces that I can say is we cannot give tuition reimbursement. That's not an option with the federal funds. We can give tuition scholarships programs. The program would be a different type of program. By the nature of the grant, we can't.
But a
replace it.
scholarship is pretty powerful.
It is very powerful, and we can do a lot with these funds, and we want to do a lot with these funds.
I recall last year seeing that Vermont had a shortage of maybe 5,600 nurses and over 300 physicians. And that seems pretty weighty to me if we stop
Agreed.
any of this. Yeah.
Agreed. And what I'm particularly interested in is looking at ways in which we can ensure that we hire and train nurses and doctors that work in primary care and want to stay in Vermont, who weren't necessarily thinking of staying in Vermont before getting these funds. Okay.
Yeah.
That's the kind of thing I would like to really hone in on. And when we're looking at, what we might have from RHTP, build the program around that.
Lynn, go ahead.
I would like to hear, okay, I have this as my portfolio, your budget.
Yes.
I would like to hear you discuss AHEC now.
Yes.
And then when you're done, I want to ask just a
Yeah.
couple of questions. And I can go into this later with you offline
Yes.
when I sit down with you to go through the budget, but I'd like you to do AHEC
Yeah,
first. before
absolutely.
I ask the question.
You ask your questions. Yeah, that's.
So the recommended budget would end the global commitment funded grant, which is $500,000 that provides support for the statewide area health education centers. And the focus of that is to promote healthcare careers among college, high school, and middle school students. It also would end a $50,000 grant to UVM AHEC program to recruit UVM medical students and medical residents to work in Vermont. So those are the specific programmatic cuts that we are proposing. These are not easy choices, and will have impacts. Will have impacts on AHEC for sure.
Okay, so the question I have is when we had a whole group of you here.
Yep.
You probably were here.
Yep.
One of the things that was said by the secretary or someone was that they were going to take these two programs, try to
Yep.
find a way to combine them and make them probably more efficient and,
Yep.
and I have a more than passing interest in this because I'm a legislative trustee on the Vermont State College system,
Yep.
which means we do a lot of nursing and
Yep.
hygiene, radiology tech, all that. Those were critical occupations that got ARPA money, lots of ARPA money. I think that those were done really, with VSAC that got it, they were the forgivable loans.
Yep.
With the requirement that you work so many years, or
Correct.
each year you got a forgivable
Right.
towards your loan.
Yep.
And if you didn't work here, they would transfer to a loan and you had.
Yep. Right.
Now, so is that what you're talking about here in the VSAC? That this is a different program?
This is not for loan forgiveness at all. This is for running the program to encourage students to enter healthcare fields. The other money, that's the loan repayment and forgiveness.
The AHEC.
no, AHAC is not, VSAC is.
BSAC is, yes,
Yes.
okay. And you give a bunch of different categories for that.
Correct.
That's different from the ARPA money that was given. Different, okay. Now, the AHAC, I was unaware that AHAC was involved with high school and college students. I'm not sure about the medical students and residents.
Yeah.
Probably the residents I've been aware of, but my understanding of AHAC, it was a forgiveness up to $20,000, depended on how many Medicaid patients were being served, increased number of Medicaids, and that was direct forgiveness to a practicing
Yep.
primary care doctor, dentist, physician. And you got it whether you stayed here or not,
Yeah. So to be clear, we're not the only funders of AHAC.
right?
And
This
my
is your
understanding,
piece.
my understanding is our piece is not that. It is more programmatic and staff to run the program, which again encourages the middle school, high school, and college students to enter into these fields. It's not around loan payment or loan forgiveness. That's my understanding.
Okay, all right, that's good. I can get into it later with you,
Yep.
but, the concern I have is that I need data to see how this worked out for your high school and college students, and
Yep.
even for your medical students are probably
Yep.
gonna graduate, go on to a career anyway, but
Yep.
yeah, everybody and their brother sometimes, wanted to become a doctor, and they all got into pre-med until they got into organic chemistry.
Oh, yeah, I know. I remember many of
Or
my
physics.
friends dropping like flies.
Yeah, you know,
And again, I agree with you. Outcomes are important. What I would argue is we're not doing a good enough job because there is still a massive shortage and it doesn't seem to be getting better. Okay.
right,
So I look at this as this is a challenging year. It's really hard to talk about cutting this program. We have an opportunity with this RHDP to relook at this entire system, rebuild or reimagine what we're doing, because I would argue we can do better. We're just not getting enough nurses in Vermont. We're not having enough primary care physicians in Vermont. We don't have enough dental hygienists. I know that for sure.
I'm working on.
There's so many other fields that we need to work on, and I think we can do better.
Okay, thank you.
I just want to step back.
Sure.
Well, first, thanks for being here. I appreciate that cuts are hard to make. I'm concerned because I've been watching this department's budgets over the last several years, and, maybe the increase is 1% each year, whereas many other departments are getting 3%. And you're going down by 1.2% when we know healthcare costs for employees are higher. And I think I'm expressing some concern that the Department of Health may be underfunded. And I don't know what was asked of you, but that is I've just seen this as a trend, and then to go down near the first budget, I think that we've seen that's going down. At a time when I think that, you are playing a pretty critical role in community health, and in setting statewide standards, et cetera. So maybe I'm missing something, but I'm concerned.
I appreciate your comments, and I also appreciate the implicit thing you're saying about the value of the health department to the people of Vermont. I completely agree with you. And to be fair, I did enter this process part of the way through. The pieces that I've tried to focus on are the program level things. And there was, again, a very robust discussion about here's the programs that we've looked at across the agency and which ones do we think are really, really important. Let's continue, like the immigrant health program and providing occupational therapy services to people with disabilities and many other things that were sort of on this list that we had looked at. And while this is incredibly hard to look at these programs when stacked against others, it did make sense to say, hey, we think these programs are more important. Globally, and as you're saying, the sort of 20,000 foot view, I don't have the perspective for it because I've just been here such a short period of time. I feel very strongly about the work that we do. And I also want to be fiscally responsible, to be completely fair, right? It's important that we invest dollars in the right way and we get the outcomes that we want. And I'm definitely committed to doing that, both now and in the future.
And just to kind of touch on your other point, yes, the overall health department budget is a down, but it's because of these 3 program eliminations. Other public health funding has remained stable in our budget this year.
All right, the last slide I have is on for me, and then I'll switch to Megan, is again, the elimination of the proposal for the state prescription drug repository program. This is a program that was designed to collect unused prescriptions, resort, repackage, and provide them to Vermonters. It's a program that has been done in other states, and it's been done successfully. We had tried to find a partner to implement this program, and we have been unable to do so for a couple of years. And given that, and again, my assessment here is that the funding level is just not high enough to actually implement the work. Not that it isn't a great idea. We propose to look at that.
Seems to me that's an easier one, right, than some of the other ones that, and we're, given the budget situation and the federal situation, we all have to expect and remind ourselves, I still remind myself, programs are going to be cut. We can't keep everything. And it's going to be hard and be unhappy with the decisions, or somebody will be with every decision, right? Maybe not the drug first.
And I put this slide up for initial questions, but I'm glad that you guys have been asking me questions right along through it, because that's my preference.
Okay, well then let's continue that way.
Okay, now you're with me and the numbers. Again, I believe the BDH budget starts on page 10 of the AHS ups and downs if you're looking for a more holistic view of this. The health department budget, just as a reminder, is broken into 3 separate appropriations: our admin and support division, which includes the commissioner's office, business office, our office of health equity, our public health appropriation, which is the largest and includes most of our divisions, and then finally our substance use programs appropriation. This first section of the ups and downs that you'll see here is the overall changes in salary fringe from 2026 budget to this current 2027 budget that we are proposing.
We see 2020, okay, oh,
This is the difference between what was in 2026 as passed and what we are proposing.
so you don't have totals for 2027, you just have,
This is the net change. So this is that ups and downs spreadsheet that really only doesn't show the total funding, but shows the change between, for each line, the change from one year to the next. You'll see we do have some downs in here, and that is because there are 59 positions in our admin and support appropriation compared to 62 that were in the 2026 budget. Part of that is 2 positions have moved just within the health department, so out of our admin appropriation and into public health. And then we did have 1 position that was riffed due to the cancellation of the federal health disparities grant. So in this appropriation, a net reduction of 3 positions, but only 1 has actually left the health department entirely.
so that was due to the cancellation of a grant.
Yes. And 2 other positions have moved to our public health appropriation.
And the grant that was canceled, you don't need to go into great detail, but sort of what's the headline about what it did?
Yep, the health disparities program was largely an attempt as a result of COVID. COVID came about from the COVID era response funds. And it was intended to help support addressing health inequities and health disparities across the state. So we gave a lot of money to community partners.
You didn't have, was it just sort of canceled midstream and you didn't have to, they didn't claw back what you'd already spent?
No, they did not claw back what we already spent. I forget the exact time frame, but it was canceled at least a few months ahead of when you're expecting it.
So if you had spent it all, you wouldn't, that would have been that, but you had some left and they.
Yes, we did. Yeah, we did have to leave some, we didn't give any money back, anybody. Yes,
Okay, thanks.
there was money spent. This next section shows one last change to the workers' comp insurance for our admin salaries. And then after that, we have the change in our operating expenses. So those internal service charges, fee for space at our excuse me, central
Don't have
office.
to worry about
building.
any of
Okay.
those things.
Okay.
Just skip right over those.
We'll go right along then.
Oh,
This grant section is where you'll see, again, we had some internal moves within the health department. These first three lines that say net neutral to section B312. Those are, again, those programs that we moved out of the administration and support and into health appropriations. So you'll see corresponding ups there. I will note that we have those two programs that Dr. Hildebrandt mentioned, the area health education centers and the education loan repayment those are the two proposed program reductions. However, education loan repayment does have a federal grant that will be continuing and will be operated within the public health appropriation. So you won't see this 4 million of GC, but you will see this $250,000 of federal funds continuing in our public health appropriation.
So you've got a down of the 250 in federal funds, but it's.
But it's, yeah, it'll
Transferred
be,
somewhere else.
yes, it'll be an up in our public health appropriation.
Okay.
And then similar thing with this last line, the quality improvement prescribing, it's just moving to our public health appropriation. That is the last slide for our admin and support appropriation. This next slide is public health, and I believe that should be on page 11 of your ups and downs. Very briefly, net changes for positions between 26 and 27. Again, we do have some reductions here. We have 510 positions in this appropriation compared to 513 last year. And I can get into the details of those changes if you'd like, or we can just keep. Okay. Then in the last item in personal services is, as Dr. Hildebrandt mentioned, that unused prescription drug repository contract. That's our third proposed program elimination. And then similarly, we have fee for space in our district offices and our public health lab. And then the medical and lab supply line, that is the Narcan program. It is moving, it was previously operated in public health. We are moving that to our department or a division of substance use. So that will show as an up in our substance use.
Okay. And that's a special fund?
Yes, that is the evidence-based education special fund.
Okay. And so you're moving.
We're just transferring the spending authority
Right,
from
from
one
one
appropriation to the other.
Okay. Okay.
We have, there's two separate slides on our grant section in public health, just because we had so many changes this year. These first three lines are exactly the same as what you saw in admin. These are just corresponding ups for those kind of program shuffles between appropriations. And then again, very similarly, that education loan repayment here is where that federal grant is still within our budget. Final slide on public health, I believe, is the last few changes in our grants appropriation. For our immunization program, we are requesting increased spending authority in the special fund that help funds our Vermont vaccine purchasing program. This program allows the state to ensure universal access to vaccines for all people in Vermont at no charge to the individual. The program reduces total cost of vaccine by using volume purchasing contracts that we usually get through the CDC. And the program costs are funded by assessments to health insurers, which are then deposited in the special fund and used to pay for the program.
So our health insurers that operate in Vermont are paying something to help us with this.
Yes.
I think there may have been some hint of this when you talked to us in December, but this is as a result of the federal government canceling
This is
all of their immunizations.
This is not as a result of that. This is just our anticipated increase of needing more spending authority to account for the revenue that we are receiving for those health insurance assessments.
Lynn, go ahead.
Yeah, maybe this is what you're trying to talk about from December. It seemed to me there was money that we transferred from the 30 million, 50 million, whatever it was. We did SNAP. Did we do this as well? Was that totally
The only
different?
thing we have done is SNAP. How we've put in the budget adjustment, the 5 million for Section 8 housing. There's been nothing within
Yes,
this.
sir. Just wanted to double check.
Yeah,
But this you did on your own.
it's their own special fund that they have, so.
The insurers that are paying into the special fund, we just need more money to cover the increased cost of vaccine.
Thank you.
The next line, oh, I'm sorry.
Go ahead, Jim.
Why don't we just skip ahead here?
Oh, sure.
So you're just going to the next line?
Yes.
I'll wait.
You sure?
Yeah,
Okay.
I can wait. Sorry.
No, the HIV AIDS service line item, the 695,000 of general fund, that is again, another budget neutral change. We're taking our syringe service program and again, moving it out of our public health appropriation and putting it into our substance use appropriation. So there will be a corresponding up later on. Next two lines for maternal and child health program grants reflect, the first is a change in just the way the preschool development grant is being managed within the Agency of Human Services. The Department of Children and Families is the direct recipient of that grant. They manage it. The past few years, the health department has done a significant amount of work in coordination with the DCF to implement those programs. In the coming year, the health department anticipates just doing less for that grant, and DCF is taking over some of what VDH had previously been doing. So that's why there's a reduction in our interdepartmental transfers there.
And so, but you don't have a note that says it's going to DCF, but that would be the note we could make?
Well, it's so because it's interdepartmental transfer, you won't see that straight in out
Yeah.
deal for DCF because they receive it and it's federal funds in their budget. So that, we don't,
Oh, okay.
I didn't want to call that one net neutral because you won't see a direct one-to-one relationship.
Okay.
The next line, and this one you will see, you do see, this is a direct move from the health department to DIVA. This is the school Medicaid assistance claiming process. And that is going to be managed by DIVA.
And that's, the Agency of Education's involved in this one too, yes. Yeah, so I think there's still discussions on like implementing this.
Yes.
Okay.
Then our tobacco control program, this line represents a change in funding for grant costs in our tobacco control program. Overall, the program has three different sources of funding: a federal grant from the CDC, an appropriation of tobacco litigation settlement fund, and global commitment investment. And really, this change is just to better reflect how we are actually spending those three pots of money. There's no change in the overall funding of or base funding of the program, the overall spending. We're just trying to align the budget better with how we actually spend those three different sources. And then lastly, the emergency medical services line. This is kind of a housekeeping item. In 2024, there was Act 143 increased the amount of the annual transfer into this fund to 450,000. It was previously 150. So this is us asking for that extra spending authority to accept that transfer.
So what's that funding used for? Is it training? Is it?
Yes.
Overall administration?
Yep, it's administered to various EMS services throughout the state.
So what do they call it? Does that vary here across the spectrum?
Oh, I do not know the answer to. We could get back to you on that. Yeah. Yes, yeah. Any last questions in our public health?
Seems like we're good there.
And finally, we have our substance use appropriation. This is page 12 of the ups and downs. Broken record, but this is our net changes in salary fringe for the appropriation. And this appropriation, there were 47 positions this year compared to 57 last year. And largely that change is due to 11 positions were moved from the substance use appropriation to the public health appropriation. So there were ups in that appropriation. And those are our prevention consultants that work out of our district offices. Their work is not changing. We were just moving them to public health to kind of better align with the work they are doing and where they are housed in our offices of local health. Keep going. This medical and lab supplies line. This is that Narcan program that I mentioned. This coming from public health. And then finally, the substance use appropriation grants section, for substance use prevention, you see that the annual, this special fund increase is the increase of the substance misuse prevention fund. This is the 32 million. Yep, that's the 2 million. The administration anticipates the amount of revenue available in 27 to be a total of 9.5 million overall. So in 26, our appropriation was just shy of 7 million, and the 2 makes up the difference for us to meet that, that estimated revenue.
And why are federal funds going down there? Is that something they're not funding anymore?
It's the overall spending in that program code is increasing. Again, it's a scenario where we're trying to better align our budget with how the funds are actually spent. So there wasn't a reduction in any federal grant. It's just we found that we're spending a little less federal grant money on prevention and more in that substance misuse special fund. So it's that aligning of funding sources for the overall prevention.
Are we leaving money on the table?
No, that federal funding is still being used.
I'm not seeing a question at the moment, but.
Our substance use intervention line, this is the, what was listed as the syringe service program in the public health appropriation. It just now has a different name in the public health grant account code, or in the substance use appropriation grants. So this is the syringe service program. Substance use treatment, this is an area where, again, we're trying to better align our spending, how we fund our spend, but how better align our budget with how we fund our spending. So we have an increase in federal funds. We've been spending a lot of substance use block grant on treatment, and we're able, by doing that, we've been able to reduce our investment dollars spent on treatment. But again, the overall program is not being reduced. We're just kind of shifting the funding.
Okay, Wayne?
So in this, you got a syringe program here. Is this the only one? I keep hearing syringe programs. Are there multiple ones? Where's the just one?
There's multiple providers that help us operate that program, or community partners who help.
Are there funds coming out of multiple budgets? My curiosity.
It is, I believe, it's just this one.
Yes, yeah. But you hear on the news about different things, but it's individual organizations.
Yes.
I've heard another testimony. Or maybe I'm confusing BAA stuff with this.
There was some talk in BAA about increasing the amounts to these providers.
Okay, thank you.
Yeah, it's the same.
It is the same. Okay, no, I have a question, and you've written a whole report about, the opioid settlement money. And can you just briefly summarize your approach to that money? And kind of what guided your recommendations, since that, is any of that money supplementing general fund that we would normally commit to various programs? Is it funding state positions? I mean, are you moving things in-house, or is it, how much of it is going to the community? Just a general, because I will dig in and probably have a lot of questions for you, but this committee won't really hear about that until we get the bill. So.
That's a great question. I'm not fully prepared to give you everything on OSAC. I can certainly do that. I will say that, the committee gives recommendations around what to fund. It is not intended to supplant general funds or other funded programs. And in fact, this year, the health department feels strongly about a program that was funded in the past by OSAC and was not being recommended to be funded by OSAC in the former years. So we're actually moving that to the general funds because we feel so strongly about it. But we're very critical of the program to make sure that it continues to fund what we believe is important. It's been It has an opportunity to improve. That's what I will say. Because it hasn't been very clear, is this intended to say, here are the important programs, we're going to fund them ongoing? Or are we going to every year look at, here's a new thing we want to try and start? And that's something that I intend to get a little bit of a better handle on this coming session, because that's been unclear to me. And that was probably part of the reason you have some confusion.
I will say there, at least at the health department, there are no positions funded by the.
We'll have to-
Okay.
Our last line, 'cause I believe I touched on treatment, is another transfer to the Department of Mental Health for certified community-based integrated health centers. Those, there are a number of providers that previously were in the health department's budget as fee-for-service Medicaid, but they are transferring to that community-based integrated health center model and will be paid out of the Department of Mental Health. So transfer of GC.
Yes, Dave.
I apologize, you may have covered this. I just wanted to be clear though. Is our recovery network level funded at least through in FY 27?
Yes.
They're not going backwards.
Correct. You'll see recoveries is, our recovery, grant account code is not listed on here because it's level funded this year. There was no change in the funding recommendations from last year to this year.
That's not being folded into this mental health community effort that you just spoke of,
The CCBHC? No, that's
standalone, so to speak. Thank you.
Why don't, do you have a question before we move on?
Before,
There's more.
there's more
There's more, but if there.
at the end.
You'll wait till the end, okay. So maybe we go and talk about, position changes and vacancy savings, unless you, I think I'm following along in your booklet, so I kind of skipped a couple cases.
Let me, here we go.
Yeah, so I was less worried about. Oh, you had no notice of federal funds is kind of important, no notice of funds.
Yes.
But that's good. But we'll hear if there is.
Yeah.
Okay.
There's been some, some turmoil lately, but everything's been walked back, so.
I know, just wait a minute, it's sort of like the New England weather.
Wait a minute,
You
yeah.
don't like the New England weather, wait a minute.
We're trying to play defense.
Okay, so you do have some position things.
Yes, and this is some of what I alluded to earlier, our reduction, our total reduction or change in positions is a reduction of 16 compared to 2026. 18 limited service positions ended, as I said previously, because of those federal COVID era federal grants. 13 of those were, again, very specific immunization, epi-lab capacity, public health emergency response grants that we knew were one-time limited funding. 3 positions were in that health disparities grant that was canceled. And then 2 positions were eliminated because of a lack of work or just the work was reassigned to other positions within the health department. And then we had an addition of 2 positions that were not in the 2026 budget. So net of 16.
Okay, so,
Yes, sorry, net 16 down.
right. The 2 positions eliminated due to lack of work, they were reassigned, but not to,
The work was just the.
yeah, I get
The
the
amount
amount
of-
of work, but they were, if they were reassigned.
The work was reassigned to other positions.
So those
Yes.
positions were eliminated.
Yeah.
Okay,
And then for vacancy savings, we didn't have a line item on our ups and downs because our rate did not change compared to 26. We kept it at 3%. The health department is seeing an actual vacancy rate of about 8% right now. But for budget purposes, it
good.
remained at 3.
Are you having trouble hiring, or you guys have had a reasonable? If you haven't needed to hire too many people, it looks like, but.
We are, I think we have the lowest vacancy rate outside of central office within AHS. So we do a reasonably good job. I will say writ large, public health is a concern of mine recruiting going forward. I'm very worried about college kids going into public health today.
Or not going into it?
Correct. I mean, still what's going on nationally. I mean, you're seeing massive cuts on the federal scale and the number of jobs globally going down. That's usually not an enticement for people to go into this work. So I am very worried about that right now.
Yeah, but that's a long-term
Correct.
process, and if people are feeling that way now, we may not feel the effects of it for 4 more years or.
I've already reached out to UVM's public health, education program, just to do anything that we can to continue to encourage that. And one thing we are working on is internship programs, which has been a little bit more haphazard in the past, and we want to make that more formal, so we have a pipeline for people to go in public health.
All right, what else do we have here?
This is the next page of,
Real quick.
Yeah.
Does UVM have an MPH, or does anyone in the state have an MPH?
Yep, UVM does.
You guys,
Yeah.
The next item is just a general description of our subgrants issued by the health department. We have a very large portfolio of subrecipient grants that we help administer. Last year, or the current year, we have about 450. So you'll see in our detailed budget, it's switch quickly. This document that was also sent along with you, we tried to, for the grants where we knew who was getting the money, the kind of recurring, not appropriations, but the recurring grant opportunities, we tried to list those specific.
Book.
We tried to list those specific, whoops.
And before you had changed to that, I had turned the page and I see the subgrants that you're not renewing, which is what we had talked about at the beginning, but this has the dollars broken out as I was madly taking notes and doing it badly.
Yes.
There they are.
Yep.
Okay.
Yes, this next slide is the breakout of those
Yes.
2 program eliminations to VSAC and A.
Okay. Okay, that's helpful to see that page.
The next slide is just a description, just blurb really about the fact that we did not have to carry forward funds, or there was no carry forward at the end of.
Were there reversions?
I don't believe so, but I will have to get back to you on that.
Okay.
The single audit findings, the health department had, the most recent audit was 2024, the 2025 is still being finalized, but there were 2 programs to have, with findings in the health department, 2024, and corrective action plans have been implemented.
What was the nature of the findings?
One was excuse me, a FFATA, Federal Financial Accountability and Transparency Act compliance finding. And the other was a case of program documentation being submitted to the federal government that we couldn't find the backup for that. But so neither were a material weakness. Both have been corrected. Correct.
It said 2 programs were found to have material weaknesses.
I believe that was a misstatement. I believe they were the same program.
But the weakness.
There were two weaknesses in one program.
Okay.
I'll double check, but I
Okay.
believe that's the case. Admittedly, the 2025 audit is still very fresh in my brain, so I'm thinking.
That's where you're focusing on it. Okay.
This next suite of slides is really just to try and help present all of the accreditation work, results-based accountability, performance metrics that the health department goes through on an annual basis to review and analyze our various programs. So we are an accredited health department since 2014. Part of that is, we need to ensure that we use that results-based accountability method, or method isn't the right word, but we use results-based accountability to review our programs. So we do have there's a scorecard if you're interested as part of that national accreditation. So we have many, it's a large set of scorecards where we review our
Yes, I
programs.
remember when Drew was at,
Yes.
I was on the old government accountability committee. And she would come in and she was such a champion that the whole agency really, went to work on that, which was great.
So, obviously, you were here before, you heard me ask questions about, being able to track everything. Again, it's a big possibility, at least, of this $5 million rural transformation fund coming in. Do you feel fairly confident that you're gonna have in place the systems necessary to track the money that goes out to those? Manner that's going to be amenable to audit?
The health department and the Agency of Human Services has very strong internal controls on our financials. And I don't want to misspeak, but for me as a financial director, one of my priorities for the money that's coming to the health department is to make sure that we can track it and be responsive to any and all federal and state reporting requirements.
We're really not going to know about that until the federal budget passes.
It's the rural health transformation program isn't set in stone yet.
And in fact, just to let everybody know, since it's come up, the Joint Fiscal Committee has to accept the grant, and we are meeting publicly next Friday from 12:15 to, we hope it won't be 2 hours, but 2:15 to review the grant publicly and talk about it and then accept it. So
we have an opportunity to accept it.
we can't make changes to it.
Right.
And the legislature has no authority to direct or reappropriate the money or do anything. The only thing we can do is, as the Joint Fiscal Committee, is to accept the grant. We could choose to not accept the grant, and then we wouldn't get $195 million a year for 5 years. So, but we want to sort of publicly accept it so that everybody can understand, and there'll be a reporting of how it's all supposed to work and all of that stuff.
Just to your specific question, there was a discussion of, do we have enough resources in our finance departments to appropriately administer this loan? And we looked at position level, hey, do we need to add positions and where to make sure we're effectively administering this loan? So that was part of the discussion.
If we have, obviously, there's a risk that if we don't, they could ask us to start giving money back.
Right. I think that's on everyone's radar. It's how do we prevent that from happening?
And did you have a question?
Yeah, I just want to say, federal audits for federal money occur every year, so you should be able to, as it's spent or as it's been granted, you're going to have the requirement. Maybe it isn't going to be you guys so much as it will be the HS central office or whoever does it. But there will be, I mean, every federal grant, you know.
Yep.
Student financial aid for someone
Yep.
who drops out 2 weeks into school and doesn't get notified until 2 weeks later. That's an issue. That's a warning issue on an audit. It's picked up all the time. So the question I have is, this is not going to supplement programs. It's not a program grant. It's a transformation grant. And it's going to look at how you organize things and how you hopefully can be more efficient and provide the services better to a broader variety of people among all these different areas that you have in healthcare. Is that correct? I mean, it's not going to be a program that we go and we stuff the money into.
So it's somewhere in between, I would say. There are some programs that we are going to be reimagining or rebuilding. I'll be very specific to the Department of Health because that's what I know. There's money that's looking at community paramedicine and mobile integrated health, okay? The way we deliver emergency medical services in the state, we need to look at and perhaps change so that we can, in my opinion, infuse some more money into our EMS system so that they can be viable and provide different services that don't require people to go to the ER every time. Make sure that they can get paid for that. So it's a program in that we're looking at the way in which we do this. We want to structurally change some things and put some things in place so that going forward, it's not going to require ongoing funding, but it's set up in a different way. So it's not a program in the traditional sense, but it will be a piece of work that requires a program manager to implement and rechange that system. And there's a variety of different ways in which that'll pan out in this thing, some of which are certainly within the health department and across HS.
So I'm looking at our time and we have 5 minutes. Is there anything else you want to be sure that we know about?
Don't think there's anything on my end, just, we've tried to be responsive to your memo with these slides.
Yeah.
And our budget detail book. So please feel free to let us know if there are any other questions or.
I think we have, this is a combination, your ages, Tiff and Lynn both have parts of this, so there are liaisons.
Yeah, she's got public health and admin, and I've got, B 313.
Right, that's something. So, I hope, Dr. Hildebrandt, you have not been through this before, so I don't know, I don't have anything to compare it to. You've been through it before, but it sounds like you all found that sort of joint process as an agency helpful in getting to what you need to get.
And the feedback I've gotten from my fellow commissioners who have been through it before, it's very, very helpful. I can say that it was helpful for me for sure. I don't know what it was like before, but again, to see the landscape of all of AHS was a helpful.
I can imagine that would be so. Appreciate the work that you all have done and the whole agency has done to work on this collaborative. Not always easy, some tough decisions. We'll be learning more. And thank you so much for your time.
Thank you.
Appreciate it. So committee, we are going to be back at 1 o'clock. We have 3 items this afternoon. We have the Department of Human Resources. That's yours, right?
Yeah.
HR.
Do you have?
1 at 2 o'clock, the Department of Corrections. And at 3 o'clock is